I moved into this role by, first of all, studying a degree in IT and business information systems. I then went on to do a 3-year degree in King's College for nursing, adult nursing, and I moved into nursing practice. After nursing practice, I practiced for a few years, and then I saw a job role called a clinical analyst, where I thought it was a good combination of both my degrees. I could combine them together and also still be involved in patient care. So being a clinical analyst allowed me to configure the system for clinical end users and administrative staff as well, in order patients to have efficient and effective documentation of their care within the hospital. I did that for a little while, and I was then headhunted from an American company to work on their healthcare system. And I since went to New York and practiced over there as a clinical analyst, a similar role on a different system for a year and a half. I had to do 2 further qualifications in order to take on that role. And after a year and a half, I came back to the UK and studied as a project manager. And after doing some implementation, some projects for my old trust, then I fell back into being a clinical analyst, because that's where my heart lies, basically. For the current role that I'm in, I completed a certification in the modules that we're using. So we're using a healthcare software called Epic, and I had to complete a qualification in the clinical documentation side of the implementation and the STORK, which is known as the obstetrics and gynae module. My key responsibilities for my role is to ensure that the quality of data in the system is accurate. So that can be from meeting with subject matter experts within the hospital to ensure that we have the requirements jotted down and everybody's agreeing that that's what the requirements are, to then build in the requirements within the system, ensuring that if there's any dependencies within the system, that they are identified and the relevant teams are informed or work with us in order to rectify if there are any problems with that. I'm also looking after a team of 5 people, so I ensure that if they have any problems, I'm able to troubleshoot with them and direct as appropriate. I also look at alerts within the system to make sure that the system is functioning correctly, and also I report on the information or data that's put in the system and extract those reports either operationally or to other departments that require that data. Professionally, I bring my clinical skills from a nursing background, working in the operating theatre, working in the wards, working in clinics. I'm able to understand how the actual clinician works and uses the system or would like to use the system. I know that time is precious, so I always factor that in, and I also factor in patient-centered care as well. I've been a patient, and I always think about how the patients would think about the system and the technology that's being brought into the hospital. I bring my IT skills, so I have a background in business information systems, so I have analytical skills that I bring towards the role, and I'm able to use both clinical and IT professions, bring them closer together. I would say on a personal level, I would say I have a non-judgmental attitude, and that stems from my clinical background. I look at things as they are and try and expand on the outcome if I can. So if I have a set remit of what I need to do, is there any way of increasing that for the best possible outcome? I motivate the team, so I'm a good motivator. I share some jokes sometimes with the team to pep up morale. And I also, I've won an award for the most helpful person. So I think I like to think that I'm a helpful person and like to help in any situation that I can. And if I don't know how to help, I probably know somebody that does. Innovation. I like to create. I have an arty side, so this allows me to create pathways, systems, um, um, annotate things within the system. So I like to create different things, and it also kind of triggers my analytical side as well, reporting things out, looking at where information is being put in, how we can transport that information to different organizations, or how we can actually display it in graphs and pie charts and things like that.